Hello, today we are going to discuss about guidance and counseling part 4. In this topic we will cover problems or issues of counseling in nursing, approaches of counseling and types of guidance services. Problems or issues of counseling in nursing. Problems are happen to counselor or a counselee during counseling section. First one, counselor burnout. Counseling take time and energy of a counselor, so the counselor has to plan the appointments or a time schedule correctly. Second one, counseling individual of a different culture. Sometimes counseling has different cultural problems during counseling, so the counselor has to identify the cultural problem and take better solution for counseling. Third one, resistance to counseling. Sometimes counselee or a client has no position due to fear and anxiety, so they may not attending counseling properly. Fourth one, counseling individual with a strong emotion. Sometimes counseling may get a strong emotion and may not attend counseling properly. Fifth one, non-complaints of therapy. That means counseling section never ending in one appointment or many section will be in a counseling. Sixth one, unawareness of a counseling. That means we think that counseling is needed for a mentally ill person. That may hinder the attendance to his counseling session. Counselor develop higher ability for establishing rapport or relationship with counselee. Seventh one is confidentiality. Next, move on to approaches of counseling. Based on the nature of a counseling process and role of counselor, there are three main approaches to counseling. First one, directive counseling. Second one, non-directive counseling. Third one, eclectic counseling. Directive counseling, otherwise known as prescriptive or counselor centered or authoritarian or psychoanalytic counseling. Counselor plays more active and direct the process of counseling. Counselor is more competent than counselee, that means client. It mainly operates individual aspect and it is more important through emotional aspects. Steps. First one, identify the counseling problem. That means counselor analyze them. Second step is explain diagnostic procedure. Third step is finally suggest the solution of the problem. Advantages are economical, less time consuming, less resources are needed, process tend to be planned and it should be objective, impersonal and more suitable to solve intellectual problems. Disadvantages are it does not develop self-confidence and self-direction in the counseling. It make counseling dependent in a counselor. It focus and center the problem, not individual. Non-directive counseling, otherwise known as permissive or client-centered counseling. It is a developmental or it is introduced by a Carl R. Roger in 1942. The role of counselor is relatively passive and client has to take responsibility to exploring his or her problem situation. Principle of acceptance and tolerance is very important. The steps are: first one, client comes for a help. Second one, client express emotionalized attitude freely. Third one, this leads to development of insight. Fourth one, client terminate the contract. The main advantages are it is an individualized approach. It develops self-confidence and self-direction. It respects the personal autonomy of counseling. The disadvantages are it depends on the individual who are unable to express themselves and may be hostile, inferiority complex, anxiety, low IQ. Eclectic counseling. It is developed by F.C. Thorne. Neither adopt directive or non-directive counseling. Based on that, all individuals differ from one another. A single approach does not apply to each individual. It should be considered personality, age, gender of client, type of problem, and thereafter appropriate approach of counseling should be determined. The main steps are: first one, in opening phase, counselor develop rapport with counselee. Second one is a tentative diagnosis needed which involve the collection of history and plan of counseling. Third one, assimilate the information about him or her. Fourth one, counselee achieve the emotional insight and behavior and alter the his or her perception. Fifth one, counselee make decision and plan to solve the problem, that means termination phase. The main advantages are it is individualized, self-confidence and self-direction is developed. The disadvantages are the counselor should be competent to provide his type of counseling. Next, move on to type of guidance services. According to Kocher, in order to meet the important needs of students, an effective guidance program will have to offer the following surveys. First one, admission surveys. It mainly concerned with admitting the right candidate for a right course for maximum advantages both to individual and society, and selecting those candidates most likely to succeed and to keep wastage figures and dropout rate at the minimum level. Second one, pre-admission surveys. Third one, orientation surveys. Fourth one, student information surveys. That means it mainly concerned with assess the students to obtain the realistic picture of his abilities, interest, personality characteristics, achievements, level of aspirations. Fifth one, the information surveys. The information provided under these surveys are educational information, occupational information, personal social information. Sixth one, counseling surveys. Seventh one, placement surveys. An increasing global demand for a qualified nurse has considerably improved the status of placement services in a nursing institution. Eighth one, remedial surveys. Ninth one, follow-up surveys. 10th one, research surveys, and last one, evaluation surveys. This is regarding guidance and counseling part 4. Thank you.